Good morning, everyone.
Good morning.
Thank you. Sorry for the late start. Thank you all so much for your patience. Let me recognize the presence of the Minister for Health, Wellness and Social Services, Honorable Kasani Laville, Chairman of the Dominica Hospital Board of Directors, Dr. Donald Peters, Chief Executive Officer for the Dominica Hospitals Authority, Dr. Kenneth Daru, Dr. Carl Munro, Accident and Emergency Specialist, Mr. Bernard Barry, Security and Safety Manager, Mrs. Sherry Shillingford Sorrendo, Information Research Analyst and Manager for Health Management Information System, the management and staff of the Dominica Hospitals Authority and the Dominica China Friendship Hospitals, and of course our friends from the media. Good morning once again, and welcome to this inaugural press conference hosted by the Dominica Hospitals Authority. In our efforts to enhance transparency and strengthen our public engagement, we believe it is critical to provide platforms for open communication, such as this press conference, addressing key concerns raised by the public, highlighting recent advancements, and providing updates on matters of health and hospitals. This initial press conference serves as an opportunity to connect directly with you, the media, who will have the opportunity later on to ask questions. And to officially begin this conference, I invite the Minister for Health, Wellness and Social Services, Honorable Kasani Laville, to deliver his remarks. Please make him feel welcome.
Thank you very much, Ms. Martin. I wish to recognize in a special way the Chairman of the Dominica Hospitals Authority, Dr. Donald Peters, and various board members who are with us today, the Chief Executive Officer of the Dominica Hospitals Authority, Dr. Kenneth Daru. Let me recognize the Hospital Medical Director and Senior Management and staff here with us, Dr. Carl Munro, Mr. Bernard Barry, Mrs. Sherry Shillingford Sorrendo, and various staff of the ministry who are here with us today. Dr. Kira Paul, of course, Permanent Secretary. Greetings, all of you, and most importantly, the people who are listening here today, and of course, the media. Welcome to you. I am pleased to officially welcome you to this press conference of the Dominica Hospitals Authority. Today's engagement is quite significant, both for the information that will be shared with you and for what it represents in terms of transparency, accountability, and public engagement in our hospital system. This is the first press conference of its kind for us, and I commend the authority and the management team for taking this very important step. Open communication with the public is absolutely essential to building confidence in our health institutions, and today's initiative represents a mature and responsible approach in hospital governance. The administration of public hospitals in Dominica is governed by law. The Dominica Hospitals Authority Act number 8 of 2021 established a modern legislative framework for management, regulation, and oversight of public hospitals, including the Dominica China Friendship Hospital. And that framework was further strengthened in December of 2024 with the passage of the Dominica Hospitals Authority Amendment Act, Act number 13 of 2024, which reinforced governance standards, clarified institutional rules, and reaffirmed the principles of accountability and patient protection. Within this framework, the Board of Directors of the Dominica Hospitals Authority is entrusted with driving hospital policy and providing strategic oversight. The authority's management team, under the leadership of the Chief Executive Officer, is responsible for day-to-day operations of our hospitals and for translating policy into effective service delivery. Over the past year, the authority and its staff have carried out significant workload under demanding, very demanding circumstances, I must say. But despite this, these operational pressures, challenges, evolving health needs, and heightened public scrutiny, our hospitals have continued to deliver essential services to the good people of Dominica. I wish to place on record my absolute appreciation for the dedication and determination for the critical staff, the administrators, the management, the support personnel who've worked consistently to maintain services and to strengthen our system and to uphold professional standards every day at this institution. Thank you sincerely. This morning, selected managers of the Hospital Authority will present to you, the media, and to the public. Presentations will include hospital performance statistics for the past year, 2025. These figures will provide the public with a clearer picture of service delivery, utilization, operational challenges, and areas of progress across our hospital system. Transparency of this nature is not always easy, especially with the sensitivity in operating a hospital and protecting patients' privacy. But it is absolutely necessary, and I welcome the authority's willingness to engage openly with the public. The presentations will also outline plans for 2026. As Minister, I view this forward-looking approach as absolutely essential. Healthcare leadership is not only about reporting on past performance, but about planning deliberately for improvement, sustainability, and resilience. The plans you will hear today speak to strengthening patient care, improving operational efficiency, and continuing to build a hospital system that is responsive to national needs and aligned with policy direction. The role of the Ministry of Health, Wellness, and Social Services is to provide the national health policy, strategic leadership, and legislative oversight while supporting the Dominica Hospitals Authority to carry out its strategic mandate. The day-to-day management of the hospital rests solely with the authority, and the separation of these roles is intentional. It is good governance, and it allows hospitals to function professionally, efficiently, more responsively, and within the ambits of the law prescribed in the Dominica Hospitals Authority Act. As we look forward and we look ahead to 2026, I want to state clearly that the ministry looks forward to continued collaboration with the board and management and staff of the Dominica Hospitals Authority. Our shared objective in the hospital system that is accountable, resilient, and focused on people-centered care. The ministry remains committed to providing the policy support, legislative framework, and strategic guidance necessary to support the authority as it leads hospital governance and service delivery. In the same spirit, yesterday I had the pleasure to sign a multi-country cooperation strategy for 2026 through 2031 with PAO in various OAS islands and Barbados. We stand to benefit from $1.7 million where the hospital is also aligned to directly benefit and get support for health systems leadership, strengthen governance, integrated people-centered care, and strengthen capacity for emergency response. We are in the process of finalizing some critical senior management positions, particularly in nursing, as well as various other management positions, all in an effort of strengthening governance and ultimately improving healthcare outcomes for our people. Over the last 2 years, we have consistently prioritized healthcare outcomes. And not only that, we have prioritized our staff and resource allocation for the hospital with tremendous focus on human resources. In the past 2 years, we have seen increases in salaries. We have appointed over 100 nurses in our system, created 26 permanent positions for medical doctors and various specialists, created 34 full-time community health aid positions, in the process of appointing and creating temporary positions for 9 environmental health officers, and we continue to do so as we review various positions at all levels throughout our primary healthcare and secondary healthcare system. So this is forward-looking. It looks positive for our orderlies, our domestics, various aides, our handymen, everyone across our system. We continue to prioritize you because we believe when we do so, the people of Dominica stand to directly benefit as your focus will absolutely be on them and providing better healthcare outcomes. Ladies and gentlemen, healthcare is the cornerstone of our national development. Strong institutions, clear leadership, and honest communication are essential to sustaining public trust. Today's press conference reflects that commitment, and I'm happy to be here in support of this wonderful initiative. I thank the board, management, and staff of the Dominica Hospitals Authority for their work over the past year, and I look forward to working together with you closely throughout 2026 as we continue to strengthen public health care for the people of Dominica. Thank you sincerely.
Thank you, Minister Laville, for your remarks. 2026 looks like marked improvement in healthcare for Dominica with so much already in place. Let me recognize the presence of the Permanent Secretary for the Ministry of Health, Wellness and Social Services, Dr. Kira Paul. Welcome. The Dominica Hospitals Authority was established to centralize the management of hospitals in Dominica, namely the Dominica China Friendship Hospital and the Marigot Hospital, providing leadership and direct strategic engagement for all health services. Leading the board of directors for the Dominica Hospitals Authority is Chairman Dr. Donald Peters. I now invite him to give his remarks.
Thank you. Good morning. Let me first recognize Honorable Kasani Laville, Minister of Health, Wellness, Social Services, Dr. Blanc, HMD, Ms. Matthew, Mr. Frazius, and all our DES, Ms. Laville, our senior officers. Thank you for being here. And our staff at the table, Dr. Monroe, Ms. Soreno, Mr. Barry. I think I have to thank my PR officer for calling the first press conference for the year. Historically, we hear a lot of death and debris out there, but I think the institution itself have to inform the people of what's happening, and this is the first step in that direction. It is behind the scenes in this hospital, in those hospitals, because we are responsible for 2 hospitals. There's a lot of work to do. Hospitals are not a school or a shop. It's 24 hours a day. So people are required to work 24 hours a day to save lives. So for me, this is the most important responsibility in the entire country, and we take it very seriously. As the minister pointed out, the board was established in 2021 by the government of Dominica, led by Prime Minister Skerritt. He was very passionate about that. I remember I used to be on the Health Commission, and he told us that beginning in 2021, he wanted to move away from the Ministry of Health. It's too cumbersome, and he wants a board to run it. And I have to inform the people, a lot of people thought that we had privatized the hospital. The hospital is still the national hospitals. They are public hospitals, and our statistics will show you the amount of people we see and what we do here. The body is comprised of 9 prominent and cooperative citizens, and I'm the chair, and we work cooperatively with the Ministry of Health and the management staff to do their work, which is to run an efficient hospital. It has not been easy for us, and there are challenges. My mother always told me, never talk about problems and challenges, fix it. So as chairman of the board, what I'd like to do is to fix it, and we have been working on that. So for us, I will just tell you what our plans are for the next coming year. The first one is, in case you did not know, these hospitals need to be accredited internationally so that when foreigners or anyone comes for the insurance, whether it's foreign or not, we can accept them. And our standards need to meet international standards in order to do that. So that is on our schedule, and we have been working on it for three years, and we intend working accreditation in Canada to get accreditation done here. The second thing, and probably the most important thing we're working on, is stabilizing our finances. Healthcare globally is the most expensive expenditure for any government, including the Trump United States. This is so expensive that some governments just cannot afford to make healthcare free. But in Dominica, we do so. And later on, I will just ask that people help us by paying the bills. Thirdly, we want to work closely with the Ministry of Health and Public Health, because I will tell you a number, and we probably will see there. 68% of all the people who come through A&E are not emergencies. They use it as a clinic, and you can understand the dynamics. If 100 people come through A&E a day, and 68% have probably a stomach ache or flu virus, what about the ones with the broken arms, broken legs, or acute heart attack? So we need to manage this, and I can appeal to the public, please go to your health center instead of coming all the way to Goodwill if you have a flu virus. Of course, sometimes you do not know what it is, what's wrong with you, and you have to go to hospital, but you need to minimize that. So if we work with the public health, which are the health centers all over the country, we probably get a handle on it. Another exciting thing that is going to happen to the board, and for the hospital, and for the community, is that this year we expect to institute the HMIS, Hospital Management Information System. That will digitalize all our records nationally, so that when Mrs. Jones from Lapland comes, she's a diabetic, and they refer to there, we already have the data on it. It will speed up the care, speed up the diagnosis, and probably deliver better care. So this is one of the things that we're working with, and that works with the government of Dominica. $8 million have been allocated to do that, and we're in the process of getting consultation to install the systems. And in fact, one of the most important thing that is important for all of us as citizens is to improve the delivery of healthcare. I read all the same complaints you see about nursing services, about time, waiting in AE. These are not new problems. They are not problems, actually. This can all be solved, but we have to do it scientifically, without emotion, and get it done. And I think we can do that. We have good managers. We have a strong leader in Minister Laville, who understands the challenges, and so I'm optimistic with the board that we can get those things done. Finally, I'd just like to go back to the financing, because that is critical. You cannot run hospitals without funding. The government of Dominica spends about $28 million on healthcare every day, and a portion of that is allocated to the hospitals. However, that alone couldn't run the hospital, and we depend significantly on fees. And people have to understand that small fees are being charged. The fees approved by cabinet is small compared to what the cost actually is. So if you get a bill for $400, that should be $4,000. So please pay the $400 because we need it. This is so critical. I know people want to pay their fees, but maybe they forget. So you'll be surprised. We're the only institution that open till 8 o'clock at night. We have a cashiers all day. That's so important it is. So for the public, understand if you have a bill, you can pay it. And on Saturdays too, right, Mr. British? Yes. So we have been optimistic, and I'd like to thank the board and all of the staff who've been working, because all of the things I'm telling you, you will see some of it, is very systemic. Right? And we do a lot of work. You will notice, imaging is one of our strong departments. You will notice that they do 21,000 imaging procedures a year. 21,000. So patient visits. So I think there are problems, but I will not talk about them. We all know them. Some of them are physical, but we're working on those things. So on behalf of the board, I want to thank you for being here. I want to thank the press for letting us talk with you. And we look forward to a successful year with minimal problems at our hospitals. Thank you.
Thank you, Dr. Peters, for your remarks. The Health Management Information System spans across the entire public health system in Dominica, both primary health care and facilities under the Dominica Hospitals Authority. He also spoke to accreditation, and if I remember correctly, last year when the photovoltaic system was commissioned, that took us one step closer to achieving that goal. So we are well on track, right? Amen. So advancements are being made in healthcare, some that the public may not be aware of or are sometimes overlooked. These include increased survival rates for premature births, successful surgeries, and much more. And we have with us our information research analyst who will provide us with a detailed report for 2025. Please make her feel welcome.
It's a good one. Okay, good morning to everyone. I would like to acknowledge the presence of the Honorable Minister of Health, Wellness and Social Services, Honorable Kasani Laville, the Chairman of the Board of Directors, the Dr. Donald Peters of the DHA, the CEO of the Dominica Hospital's Authaurity, Dr. Kenneth Darrow, the PS of Health, Wellness and Social Services, Dr. Kira Paul, other managers, DCFH staff, media, good morning. And thank you for being here today as we share an overview of our clinical service utilization data. This briefing is part of our commitment to transparency, accountability, and evidence-based decision-making within our health system. The data you'll see here today reflects on the volumes, the patterns and pressures across our hospital services. These figures represent how our population is using healthcare, from the inpatient wards, the emergency services, to surgery, outpatient clinics, and diagnostic and imaging. Overall, the findings show a system that is actively serving the population, managing consistently high demand, and maintaining key quality outcomes in critical areas such as the maternal and newborn health. At the same time, the data highlights areas where service pressures remain, particularly in the A&E department, in terms of demand, bed occupancy, outpatient attendance patterns, and identifying these trends allows us to improve on how services scheduled and delivered. So this is not simply a presentation of numbers. It's an opportunity to explain how the hospital data guides operational decisions, resource planning, and service improvements. The goal is to ensure that healthcare delivery remains safe, it remains accessible, and responsive to the needs of the Dominican population. So welcome, and thank you for being here, and thank you for your questions. So in terms of, let me move this way. In terms of our overall hospital service activity for 2025, in terms of the DCFH, we had a total of 5,915 patients seen across 9 of the inpatient units. In terms of the outpatient visits booked, we saw just over 25,000 patients. So the total number was 25,259. The total number of patients seen in those booked clinics totaled 16,494. Accident and emergency department visits totaled nearly 23,000, so the number was 22,863. Surgical procedures performed at our operating theaters, 1,644. The total number of live births documented, 513. The total number of deaths we documented, 342. And within the imaging department, total number of patients processed, 21,072. So you can see from these numbers, it reflects the scale of the type of service rendered at our hospital, specific to the DCFH. In terms of the inpatient service review, as previously mentioned, we had just under 6,000 inpatients across 9 of our inpatient units. The medical and surgical unit made up the majority of wards. Percentage distribution was our medical and surgical wards, and the demand for admissions remained relatively stable across the year. So you can see in the next slide, on a monthly basis, this is the overall number of inpatients documented in the hospital. So you can see that it was a constant value across the year. In terms of the distribution of inpatient admissions by the specialty, 38% of the patients that we saw were actually admitted to the surgical unit, and followed by the medical unit, which made up 35% of all of our admissions. 15% of all our admissions were maternal on the Stronach unit. ICU made up 3%, so did the neonatal unit. 5% was from the acute psychiatric unit, male, and then 1% the acute psychiatric unit, female. When we're looking at the average length of stay that a patient stayed, we like to look at both the values, including the psychiatric admissions and the rest of the inpatients, because due to the treatment type, psychiatric patients tend to have a much longer stay. So when we remove the inpatient values for length of stay, we saw that patients who admitted to the Dominica China Friendship Hospital stayed just about a week, so 7.2 days, including the values in terms of the average length of stay, including the psychiatric unit, it would be closer to 13.4, just about 2 weeks. So on average, patients had a length of stay of about 7.2 days. When we looked at the ward-specific average length of stay, if you look at the upper area here, Emory and Glover, which is our medical wards, the males stayed just about 10 days on the ward, so slightly higher than what we noticed, the average of 7.2. Glover, female medical ward, had an average length of stay of 9.1. In terms of our surgical units, the male medical admissions had an average length of stay of 8.4. Dominica had an average length of stay of 6.1. The pediatric ward had an average length of stay of 3.3 days. Stronach 3.6 days, and that's our maternal ward. The neonatal unit had an average length of stay of 9.3 days. The ICU unit 8.2 days, and then the numbers that I mentioned, which tend to be much higher, with the female APU unit had an average length of stay of about 39 days, and the male admissions for the acute psychiatric unit was just under 37 days. So this is what it looked like when we talk about how long patients stay and where we got the averages for the hospital average length of stay. In terms of our bed occupancy across the wards, medical wards frequently operated above the optimal occupancy, surgical wards highly utilized, and then psychiatric services operated above design capacity. So when I speak about the optimal occupancy, hospitals operating above 85% occupancy is considered under system strain. So it affects the bed availability, how quickly patients are processed from the A&E department to the wards. So it's good to have a buffer capacity when patients, so that patients can get admitted to the ward if needed. So when we look at the ward-specific data, you can see that with the acute psychiatric unit, for every month over the last year, the male psychiatric unit ward was over capacity. You can see here, let me see this. You can see this, I'm sorry. The red dotted line represents the 85% occupancy, and the green line above represents the acute psychiatric unit, male unit. Now, when you look at, I wish I could see it. When you look at the other dark blue line, this represents our medical wards, both the male and female together. So I wanted to have a closer look, seeing that they have a high admission, high average length of stay. So when you look at the male, the gender-specific wards, you can see that the yellow line, which represents our male medical ward, 9 out of the 12 months they were at least over 85% or above. Some months they were above 100% occupancy. The female wards had also a high occupancy, but not as high as the male medical wards. In terms of our maternal and child health outcomes for 2025, we had 513 live births documented. Thankfully, we had no maternal deaths, and we had 1 neonatal death in 2025. Now, the neonatal mortality rate is an indicator of how a country is doing in terms of health. So one of the Sustainable Development Goals, Sustainable Development Goal 3 specifically of the United Nations frameworks, has the goal to have no more than 12 deaths for every 1,000 live births, and we can see that we are performing well below that threshold, so it's something that we should be very thankful about. In terms of the live birth trends in the last 10 years, we can see a steady decline in number of babies being born at the hospital. So in 2025, we had 513, and when we compared the values from 2024 to 2025, there was about another 6% decline. There are certain dips that you can notice with the overall trend. It can be assumed that it could be attributed to the first one was maybe the storms, and then the second one during COVID-19. In terms of our inpatient mortality distribution specific to the ward, the aggregated deaths, when we looked at the total inpatient numbers and the number of patients died, we were just about 6% of all admissions. The highest death percentage is documented across ICU, where about 30% of the patients who were admitted to ICU died. Now, you have to take into consideration that ICU patients are your critical patients. Now, in terms of the neonatal unit, we had 0.6, which documented from that one death, only the one neonatal death. Alford had just over 5% death. Dominica was at 3.8, and the medical wards, Emory and Glover had a death rate of just above 11% of all admissions. In terms of emergency department, more commonly called casualty, we documented just under 23,000 patients being seen within that unit. Now, prior to 2025, we utilized the CTAS acuity score, which is Canadian triage acuity score, and that score informs the department, or the nurse is able to calculate how sick a patient is. In 2025, we transitioned from the CTAS scoring system to an ESI scoring system, and it is for the emergency severity index. So just like the CTAS, it documents the acuity of patients. However, it also takes into account the resources that is utilized for treatment. So the sicker a patient is, the more resources you need. You need more equipment, you need more personnel, you need more supporting staff, departments, etc. So what was documented in the last year, when we look at the ESI score, so the lower the score, the more critical the patient is. That last year, between the critical score of 1 and 2, a critical patient, made up 35% of all the patients we saw at A&E department. The moderate ESI score made up just under 40% of all the patients seen. And the low acuity score of 4 and 5 made up more than half of the patients that we saw. So most of the patients we saw within the A&E department were not emergencies, according to the triaging assessment. So it is important to create a pathway between the A&E department and primary healthcare services, so that patients are not just treating their symptoms and utilizing A&E as an area for treating symptoms, but following the proper path going for the primary healthcare sector. So here's a graphical representation of what that looks like. 0.2 had a score of 1, 3.3% had a score of 2, the moderate score, moderate acuity made up 39.7%, and everything above that was a low acuity percentage. Other than the classification of the severity of patients, we also track the certain cases that come within the unit, accident and emergency. So we had a total of 214 police cases. Any patient that presents and presentation requires a legal, criminal, or medical legal implication is considered a police case. So we had 214 of those. Road traffic incidents / your MVAs made up 344 of all the patients processed within the A&E department. Patients who came in dead, 31. Patients who died within the department, 19. Patients who came within the A&E department and were referred to the outpatient clinic, 877. And then patients admitted to an inpatient ward made up 3,191. So that is about 15% of all the patients we see at A&E actually get admitted to one of our inpatient wards. In terms of the surgical services activity for 2025, the total number of surgeries that were booked were 2,075, and the total number of surgeries performed was 1,644, giving us a theatre utilization of 79%. So 21% of the patients who had surgeries booked did not have a surgery completed. So because we have the disaggregated data, we have specific data on each patient that has a surgery done, we were able to stratify that 21%. So I'll explain what that 21% looked like. In terms of the public cases completed, 75% of all cases completed at the operating theatre were public cases. And it's an important measure to track because private cases are also permitted within the outpatient operating theatre. So having a measure that documents what is the ratio between your private cases and public cases is important to make sure that access is available to the patients who go for the public sector. In terms of our elective procedures, 80% were elective and then 20% were emergency cases. In terms of the patients that did not make their appointment, we had some broad categories that we could put the reasons under. The highest category was a patient-related factor. So the patient did not show up for admission, the patient refused or withdrew consent, they failed to fast, or they came in late. The second higher category was medical or clinical factors. The patient was not fit for procedure, so they either had hypertension, hypoglycemia, infectious disease, abnormal labs. The third category, resource or logistical constraints, no bed available for the procedure, so the patient will most likely have to be rescheduled, staffing shortages. In terms of the fourth category, time-related constraints, so a prolonged earlier case, a later start, or underestimating the previous operative time. The smallest category was incomplete documentation, consultant-initiated cancellations that was not defined, or miscellaneous administrative issues. In terms of our outpatient clinic activity, we completed at Dominica China Friendship Hospital a little bit over 2,000 clinics. And within those clinics, we had 25,259 patients booked. And out of these booked services within the outpatient, 16,494 patient visits were completed. We have a very high no-show within the outpatient department, and it's something that we need to look at. We've started looking at actually. So the no-show rate was about 35%, and just under 9,000 patients did not come to their appointment. Having that delay means that other persons who want to utilize the service, their dates get pushed back. So when we looked at the specialties specific to outpatient department, the highest by far was the ophthalmology department, followed by orthopedics and oncology. In terms of the imaging services utilization for 2025, the total number of patients processed within the unit totaled 21,072. Based off the modalities, we wanted to see where the requests came from the most. So you can see that the emergency department had the highest modality requested was for X-ray for the emergency department. Inpatients and emergency, the highest request for the modality is ultrasound. CT, the requests or referrals mainly came from the inpatients, and then MRI mostly came referrals came from outpatient and the private sector. So you can see a graphical representation. This is the left side is the source of the request, and on the bottom of the graph shows the modality. So you can see X-ray, just about 6,789 requests from the A&E department, followed by inpatient, which had about 3,000 from the inpatient. You can see for CT, A&E, a high request of 1,432, followed by inpatient. Ultrasound made up, the highest request came from the inpatient unit, followed by A&E, and then MRI, the highest request came from the private sector, 298, followed by outpatient, inpatient, and then districts. In terms of Marigot Hospital, Marigot Hospital continues to provide urgent services and outpatient department specialty clinics, and urgent services are available 24/7. We completed 56 specialty clinics, 325 visits were booked, and 235 patients were seen with a no-show rate of 27%. And the doctors who work at Dominica China Friendship also provide that support within the Marigot Hospital. In terms of our urgent visits completed, we had a total of 3,579 urgent visits completed. In the latter end of 2024, primary healthcare dental services commenced, and it has been ongoing for 2025. I just don't have the exact numbers to present. So the key system observations, hospital demand remains constantly high. The emergency department handles many non-critical cases. Surgical and diagnostic services are heavily utilized. Maternal and child health outcomes are strong, and the bed capacity remains under pressure. Thank you.
Thank you, Mrs. Sarando, for your very detailed report. We invite the head table back to the front. All right, let's put our hands together again for Mrs. Sorrento, because that was really a detailed, it's a lot of data to present, but she really did an excellent job in condensing the information and presenting it here today. So I hope the public is listening, because this is the positivity that we are trying to push out there. There has been a slight change to our program here this morning. We will have the CEO present the closing remarks, so he will be the last speaker today. But before we do that, there is a special addition to our press conference here this morning. We know that the carnival season is upon us. With Carnival Monday and Tuesday just about a week away, the lead-up activities and festivities are in full swing. While we hope and pray for a safe and injury-free celebration, it is essential to remain prepared from a hospital standpoint. During this period, the hospital typically experiences an increase in both critical and, as Mrs. Shillingford-Sorrento said in her observation, non-critical situations as well. Although we trust that everyone will celebrate responsibly and avoid mishaps, being prepared is crucial to ensure the safety and well-being of all. And we really do care for our patients here, so we just want to inform you, and to do so, on access, we invite the Security and Safety Manager to deliver some remarks.
The protocol already being established. I just want to say pleasant good morning to all our persons present at our inaugural press conference for the Dominica Authorities of Dominica, as well as the listening public, both locally and abroad. I was chosen as one of the panelists for this inaugural press conference because we wanted to showcase to the public that we take the security and safety of our patients, staff, and visitors very seriously. Hospitals are places where people come at the most vulnerable moments of their lives. Because of that, safety and security are not just operational priorities for us. They are fundamental to patient care, staff well-being, and public trust. The management and team of the Dominica Hospitals Authority are focused on creating a people-centric hospital, and we've taken many steps towards that direction. Our approach to security and safety is comprehensive and proactive. The goal is always prevention first and rapid, effective response when needed at both hospitals. That's the Dominica Channel Friendship Hospital and the Marigot Hospital. At the hospitals, we maintain controlled access points, 24/7 coverage, and surveillance in public and critical areas. These measures are designed to protect patients, visitors, and staff while still maintaining and welcoming a compassionate environment. We, however, heavily rely on the cooperation of the public. We understand that everyone wants to see their family members safe, secured, and that they get the best medical treatment and that they all feel well within a quick amount of time. However, we still have rules and guidelines in place to help keep the flow of traffic in the hospital under reasonable control and to make sure that everybody is safe and secure. I have been in this position for a few months now, and it's very demanding. It's a very demanding task, trying to balance rules in a way that it does not seem intimidating or restrictive to anybody. We are a hospital. We understand that it's a stressful environment, and we're not trying to make anything more stressful for anybody. You want to come to hospital, you expect to be given that level of compassionate care, and we try our best. We have rules in place to try and work with the public, speak with them, let them know these are certain things in place just to help you understand why it's there. When it comes to accessing the hospital, everyone is welcome. Your age, status, gender, or nationality does not matter. When it comes to providing emergency care to someone, every second counts. However, we've been having some unnecessary issues when it comes to patients coming to get medical attention, especially at the entrance gate. Unfortunately, a lot of vehicles, they want to put down the passengers directly in front of the entrance gate. This has become an ongoing issue, and we've taken many steps to try and rectify it, but we still urge the public to respect the formalities in place. There's a keep clear, and as well as knowing that this is a hospital. The ambulance comes here, we want to ensure that they enter the hospital with no issues. Two, we've noticed that the two reasons for this pile-up at the entrance is usually, one, persons are being put down in front of the hospital by passenger buses or by other vehicles, and two, people trying to enter the hospital with their vehicles without having a valid reason. Everyone thinks they have a valid reason to enter the hospital with a vehicle. But I urge you, before you even try to come to the entrance gate where you most likely will be refused, compare it to the ambulance service or another family member trying to rush their loved one to the hospital to get urgent care. And you realize that your reasoning for wanting to enter the hospital to drop off food for somebody is not as important as somebody coming to bring their loved one for care. Emergency preparedness is another critical part of hospital safety. We plan on conducting numerous drills to train for a wide range of scenarios such as fires, mass casualties, natural disasters, and other emergencies. These drills will ensure that when something unexpected happens, our staff know exactly what to do and how to keep patients safe. We have been working closely with the police force, the fire service, and other emergency medical teams and public health authorities. These partnerships allow us to respond quickly and in a coordinated way when additional support is needed. As our PRO so rightly said, Carnival 2026 is just around the corner. We also know the likelihood of incidents occurring which require a trip to hospital is extremely high, just like some of our patients might be. So, as a result of that, there will be stricter controls in place to try and mitigate and try to streamline the operations during Carnival. So, I wanted to try and sensitize the public. I know it's been done before. Every year, Carnival will usually have some of these things in place, but we wanted to let the public know, especially those who might be coming from overseas, that these things are going to be in place effective February 13th to try and keep the hospital as safe and secure as possible. Upon coming to the hospital, you may have to be screened and searched by security personnel at the entrance gate. That is in a reason to try to limit or stop any illegal weapons or any offensive weapons from coming to the hospital. Unfortunately, we've had instances where people come in for medical care, but they have something in their belongings that can be a risk to our nurses, staff, and other patients. So we really want to curb this for this kind of season so that we don't have this additional thing going around for nurses to feel like their life while they're treating other people at risk. If you're going to the A&E or the Alford ward, you may also expect to get further screened there, because these areas are places we have noticed have the most foot traffic and also the most tendencies to have higher amounts of violence in these areas. So these areas there will have much stricter controls to ensure that nothing happens out of the norm during the season. I understand that this might seem a bit extreme to some, but please understand that there are legit safety reasons for this. I, as well as the rest of the management, are aware of the security concerns raised by the public. We all pay attention to social media, we've all seen the comments when different things happen at the hospital, and so we're trying to take the right steps to try and rectify all these issues. Safety is not just static. We continuously review incidents, assess risks, and improve our systems. We listen to feedback from our staff, patients, and visitors, and we adapt as risks and expectations evolve. In closing, I just want to reassure the community that the hospital remains a place of care, healing, and trust. The Minister of Health, Honorable Cassani Laville, the Dominica Hospitals Authority Board, and the management are committed to maintain a secure environment where patients can focus on recovery, families can feel confident knowing that their loved ones are receiving the best care, and staff can work safely and effectively. Thank you.
Thank you, Mr. Barry. I hope the public is listening. The onus is upon us to be diligent citizens and abide by the law. If a bus driver is putting you down in front of a keep clear, you can tell the bus driver to park in an area that is not blocking the hospital. Again, the accident and emergency department is one of the most frequented area during the carnival season, with a lot of non-critical injuries being reported. So we invite the A&E specialist, Dr. Carl Monroe, to deliver some remarks.
Good morning. Thank you, Ms. Martin, for allowing me a few minutes to address this press conference. Minister of Health, Wellness, Social Services, Honorable Cassani Laville,
Chairman of the Dominica Hospital.
Chairman of the Dominica Hospital Authority, Dr. Donald Peters, Permanent Secretary, Ministry of Health, Wellness, Social Services, Dr. Kira Paul Long, Chief Executive Officer, Dominica Hospital Authority, Dr. Kenneth Daru, members of management, Dominica Hospital Authority, Dr. China Forensic Hospital, media houses, ladies and gentlemen, good morning. Let me begin by saying thank you to Mrs. Jennifer Sorrento for doing half of my work. So let me just jump right into it. Just a few numbers, fun facts. In 2025, as Mrs. Jennifer Sorrento mentioned before, we saw about 23,000 persons, which makes about 1,900 persons per month, more or less 65 persons per day. And as we mentioned, about 68% of those were non-urgent patients. There are about 40 plus health centers on the island. So zoning in on Roseau Health District, there are 18 health centers, where in Roseau proper, which expands from Warner down to Scott's Head, which includes the Valley, Cochrane areas, there is one Type 3 health center, Type 3 with doctor and equipment to handle emergencies, which is at the Newtown Health Center. There is a Fokole Health Center, which is a Type 1/Type 3, and there's a Maho Health Center, which is a Type 1. And within the Roseau Health District, there are dental services, which is provided in the Campbell's building next to the stadium. So persons come to the accident and emergency department and require to be seen urgently. So one enters the accident and emergency department and then you're triaged. So this is a rapid assessment process used to prioritize patient care based on injury severity, prognosis, and resource availability. So you come in, you're triaged, emergency, which is a life-threatening medical condition, very urgent, and non-urgent. So just for clarity, emergency situations, for example, not breathing, seizures, fits, severe heart attack, unconscious, a limb-threatening situation. Okay, limb being arm, leg. Okay, if something's not done immediately, you may lose your arm or leg. Okay, so the very urgent persons are seen after emergencies, whereas a serious medical condition, for example, severe chest pain, shortness of breath, uncontrolled bleeding, for example. Urgent cases, you may have had abdominal pain, dislocation of a toe, a finger, and then you have non-urgent cases where the person can function without immediate care. So for example, common colds, headaches, back pain, constipation, and urinary infections. So the non-urgent cases, as Mrs. Shinford mentioned, we see the brunt of the load are non-urgent cases. So this is where I urge us to utilize our primary health system more. Okay? So the accident and emergency service plays a vital role in saving lives, but must be used appropriately. Okay? I just wanted to mention this. So a lot of times people come in, I'm there long, this person came after me, yet still they have been seen before me. Okay, so just a slight explanation. I can answer questions after that, no problem. So, and then there's something that I've noticed again. When one is sick, I'm going to say it here, when one is sick, we need to seek the appropriate medical attention. So I'm saying this to say, I've gotten calls before, can I come into the hospital? So I'm asking out there, if one wants to go to the credit union, do you call and ask who's working as a teller or how long the line is? So we call the hospital and find out who's working, okay? Or are there a lot of people in casualty? So based on that, we're choosing when to come, so we can use our health center to alleviate the load. Persons come from out districts, as far as from Marigot, for example, I prefer to come to the hospital. So I'm just urging us, the health centers are there to serve us. Okay? So our responsibility in the health center is to see the clients, stabilize, and refer to the hospital. So you may be an asthmatic in St. Joseph at 2 o'clock in the morning. I will take my chance to come to the hospital to seek treatment. Anything can happen between St. Joseph and Roseau. So the prudent thing to do is go to the health center in St. Joseph when we have the attack. Seek medical attention. If you're not resolved, our responsibility is to call the ambulance or seek the ambulance and transport you from St. Joseph to Roseau and not take the chance to come down right away and seek assistance. We have been seeing a lot of more patients, very ill patients coming in. Again, I'm urging us, use our health centers wisely. This one is targeting to women or us men, because it may sound like women. We usually tend to wait to the last, or our significant others force us to come to the hospital. So, if we see we are sick, use our health centers to prevent the critical nature of, or the point of no return. And we all know what the public says about the princess. Thankfully, Mrs. Shinford Surrender showed us the data that the numbers of deaths compared to the amount of persons coming in are not what the calypsos usually say, right? So I think it's a testament that we are trying our best. We have a long way to go. It's understandable, but okay, we are not, as the common people say, killing persons. Okay? So just a few things I just want to point out. I'm sure the CEO is going to mention of the operating theater, which was handed over to us a few months ago. I'll leave that for the CEO to mention in his speech. Where we are in the flu season. So mask wearing in the department is essential, especially for persons coming in with flu-like symptoms. Again, we're going to speak about the vulnerable groups, elderly, children, persons with chronic conditions whose immune systems are low. Okay, so mask wear is important. Hand hygiene is important. Okay, during this period of time. So again, a pet peeve of mine, we always come to check up in the A&E department. The A&E department, again, is not for checking up. I went to give blood, and I was passing by casualty, and I decided, no, I want to check my pressure. Okay? So it's, especially during the carnival period, it's not a checkup time. We're on high alert for the possible accident and emergencies. Visiting, the accident and emergency department is a dynamic area, but it's not like a ward where we have visiting times. However, we do facilitate, for example, when we have in-house patients, they are dropping off of items, we allow for drop-off periods. But before you drop off or you enter the department, we are asking you to speak to a nurse, preferably the charge nurse, to arrange a drop-off. of sheets or lunch or whatever the case may be. The number of persons in the department, we appreciate if one person accompanies their loved ones, okay, preferably next of kin. As in this would ask who's responsible for you if something were to happen. So we allow one person per patient. So for example, if you have a minor or person who can't speak for themselves, we allow one person to accompany that person. You have a 21-year-old strapping, young, conscious, can speak for themselves. We expect a history from that person. I know the mothers in the crowd might want to be with their child or their husband or wife, but if it's an overcrowded department, it may pose a problem. Likewise, in a trauma incident, it is a sensitive time, we all understand, but we would allow one person, next of kin preferably, or somebody who was involved in an accident or witnessed the incident who can give the medical staff some pertinent vital information. So we cannot expect when our friend crashes on his motorbike, all his partners want to come in, okay, to see how he's doing, or all his family members to come in. You are preventing us from doing our job because you are in, quote unquote, in our foot. Okay, so you are in our foot preventing us from doing what we want, and every step that we make, you're looking at us, asking us, what are you doing? What next? What next? Okay? Our priority at that moment is your loved one. Okay? So give us the space to do our function. Okay? So, again, as Mr. Barry mentioned, the security will be a little bit heightened. So please bear with us, please cooperate so we can make your loved ones better. Thank you very much.
Thank you, Dr. Monroe. I hope the public is listening. Do not come to the accident and emergency if you have a toothache, especially during these critical times. Carnival season is here, and our medical professionals need to attend to more critical cases. We are nearing the end of this press conference, and I must say this press conference has been very informative. Don't you agree? And definitely highlighting some of the positive that we are trying to push out there. At this time, I invite our CEO, Dr. Kenneth Daru, to deliver the closing remarks.
Thank you very much, Ms. Martin. Let me, of course, recognize the presence of my friend and brother, the Honorable Minister for Health, Mr. Cassani Laville, the Chairman of the Dominica Hospitals Authority, Dr. Peters, the Permanent Secretary in the Ministry of Health, my sister, Dr. Kira Paul, all the managers and staff of the Dominica China Friendship Hospital. I see a number of our senior nurses present, thank you. All the invited guests and managers and staff. Ladies and gentlemen, of course, the media, although I see very little media here, I suspect it probably out there covering exciting carnival events, but I'm hoping that information will go out there. Honestly, after listening to all the presentations from the Minister, our Chairman, and the wonderful presentation by Mrs. Shilin Ford and our Security Manager, and even our last Dr. Monroe, I feel there's very little left for me to say. Honestly, I want to thank you for such a wonderful presentation. I think you did us so very proud. Let's say it for them folks, please, again. But I haven't prepared a few lines. I think it's the onus is on me to share these thoughts with you. Let me begin by formally expressing my sincere appreciation to the Dominica Hospitals Authority for the trust and confidence reposed in me and for affording me the opportunity to serve as Chief Executive Officer during this important, and I might add, very critical period of the institution. I also wish to acknowledge my predecessors and past leadership, whose stewardship, commitment, and service have contributed significantly to the growth and stability of this institution, especially in the early days. It is a distinct honor to be entrusted with the leadership of this great institution, which has served the Dominican public faithfully for many decades. As we navigate the challenges of a rapidly evolving healthcare environment and continue to uphold the highest standards of service, resilience, and excellence. I also wish to express my sincere appreciation to the management team and staff of the Dominica China Friendship Hospital for the support, cooperation, and warm welcome extended to me thus far. Across all the departments, clinical, nursing, administration, allied health, and support services, I have been deeply encouraged by the dedication, experience, and sense of purpose demonstrated each and every day by each and every one of you. Your commitment to patient care, your openness to collaboration, and your pride in this institution will be central to the progress I am confident that we will make together. The year under review 2025 was a meaningful and visibly progressive one for the Dominica China Friendship Hospital. It was a year in which we strengthened clinical services, invested in resilience, built human capacity, enhanced transparency, as we are doing right now, and deepened our commitment to patient-centered care, supported throughout by the continued assistance of central government, who continues to support visibly and tangibly our efforts towards the operations and development of the Dominica China Friendship Hospital. A particularly significant development in 2025 was the creation of 26 new specialist posts within the Ministry of Health, ensuring greater job security for our hardworking and dedicated specialist doctors, while opening new opportunities for other medical officers. Coupled with a recently approved cabinet endorsed remuneration package, we are confident that these measures will go a long way in mitigating the perennial attrition of doctors, especially in these challenging and uncertain geopolitical times, while strengthening the morale, retention, and continuity of specialist care. Another significant achievement was the commissioning of a new operating theatre within the Accident and Emergency Department, a development which will greatly improve emergency surgical response, reduce critical delays, and strengthen national preparedness for trauma and life-threatening cases. On this note, I wish to place on record, like I've done many times before, our sincere appreciation to the Maria Holder Trust for its generous funding support towards this operating theatre. This contribution has had a direct and lasting impact on our surgical capacity and stands as a powerful example of how strategic philanthropy can strengthen public healthcare delivery. Ladies and gentlemen, in keeping with Dominica's resilience agenda, the hospital successfully advanced a solar energy project. In doing so, we improved energy reliability, reduced operational costs, and ensuring the continuity of care during power interruptions, particularly in critical services such as theatre, neonatal care, and intensive clinical areas. Again, I wish to formally acknowledge and thank Direct Relief, the OECS Commission, and DOMLEC for their support and collaboration. Another major step forward has been the preparatory work towards the implementation of a comprehensive hospital management information system, HMIS, expected to be rolled out in the coming months. Once fully implemented, the HMIS will allow for seamless integrated management of hospital operations, spanning patient registration, clinical documentation, diagnostics, finance, human resource, and critically supplies and inventory management. Through real-time tracking of pharmaceuticals, medical supplies, and consumables, the system will support more accurate forecasting, timely reordering, and improved stock control, significantly reducing the risk of shortages and emergency stockouts. This will enable departments, wards, to function more efficiently, minimize service disruptions, and ensure that essential supplies are consistently available at the point of care, improve inventory oversight, will also strengthen financial accountability and procurement planning, supporting better decision-making across the institution. Last year, we also saw the establishment of a dedicated Chinese-supported classroom functioning as an extension of, I hope I said that correctly, Guangzhou University of China. This facility now serves as a hub for continuous professional development, telemedicine, virtual consultations, and live specialist engagement. Through this platform, our clinicians can participate in real-time case discussions and remote lectures with international experts. The classroom also supports laparoscopy training, strengthening minimal invasive surgical skills, reducing reliance on external referral, and improving patient outcomes through modern surgical techniques. These efforts are further reinforced through ongoing training partnerships with the Pan American Health Organization's PAHO, the World Pediatric Project, other organizations, and not forgetting the invaluable contribution of Dominican health professionals living overseas. But my dear friends, among the most impactful achievements of 2025, and I think Mrs. Shillingford alluded to it, was the strengthening of our neonatal services, particularly for premature and high-risk newborns. In 2025, the hospital recorded the survival of 24 premature infants out of 24 births, meaning all premature infants born last year survived. And not only did they survive, they also are flourishing. Indeed, in recent years, we have seen premature births as early as 25 weeks survive and flourish. And this is remarkable, folks. Yeah. So just to put it in context, a slightly different twist to how Mrs. Shillingford presented. This statistic, as I mentioned, 24 out of 24, when placed against the backdrop of data from the World Health Organization, where they say that over 90% of extremely preterm babies, that is those born before 28 weeks, in low-income countries, developing economies like ours, do not survive. I want to repeat this. The World Health Organization says 90% of preterm babies, that is those born before 28 weeks, in low-income, what we call developing countries like ours, do not survive. So therefore, this data that I presented, 24 out of 24, above here in Dominica, is especially remarkable, and it's just another round of applause. And of course, it didn't just happen overnight by accident. I recall a few years ago, it was a talking about transparency, balance, and public trust. We appointed a dedicated public relations and communication officer who is mainly responsible for this event happening here today, Ms. Martin. Because in today's environment, the negative outcomes in healthcare, often isolated or taken out of context, tend to attract the greatest attention, the widest circulation, the most likes, the most viewed, etc. So while accountability remains essential, it is equally important that positive outcomes, clinical successes, system improvements, and life-saving work carried out daily at the hospital are given appropriate visibility and airtime. This ensures that the dedication and achievements of our hardworking and dedicated staff are more consistently highlighted, strengthening public confidence and staff morale. Following a reference by the Honorable Minister of Finance in last year's budget address, work is actively underway to operationalize the patient support unit. Most likely within, hasn't been formalized or finalized, within the existing quality control framework. This unit will provide patients and families with a dedicated, safe, and accessible space to engage directly with the hospital staff. And we encourage the members of the public to utilize this space, not only to lodge complaints and raise concerns, but also to document observations, offer constructive suggestions, and highlight positive experiences received at the DCFH. Because, it cannot always be bad like, it's been made to appear out there. So feedback offered in a spirit of partnership, respect, and shared responsibility will remain central to continuous improvement. Also, in keeping with our commitment to continuous improvement and international best practice, and I think the chairman spoke to it, the DCFH has advanced work towards institutional accreditation with accreditation candidates. This accreditation process is a rigorous and comprehensive journey that examines every aspect, and I repeat, every aspect of hospital operations, including patient safety, clinical governance, infection prevention and control, leadership, medication management, and quality improvement systems. It requires not only sound policies and procedures, but also a sustained culture of accountability, teamwork, and evidence-based care. Importantly, as we speak, our accreditation partners are on the ground actively supporting the process of the National Laboratory, which is housed right here at the Dominica China Friendship Hospital. And we think that this is a significant step towards strengthening lab quality systems, reliability of results, and overall patient safety. I also wish to highlight the role of the Marigold Hospital, which continues to provide essential primary and basic healthcare services to the northeastern part of the island. The hospital remains a critical access point for care and continues to serve the population with dedication and reliability. Looking ahead, plans are underway to develop this modern facility into a premier secondary healthcare institution with a strong focus on emergency and trauma services. This strategic development is especially important given the advent of the Dominica International Airport being built in the surrounding area, which will significantly increase activity and demand in the surrounding region. Strengthening the Marigold Hospital in this way will enhance national and emergency preparedness, improve trauma response times, and ensure that the northeast of the island is served by a resilient and responsive healthcare facility aligned with Dominica development goals. But my dear friends, even as we celebrate our achievements, we have not been without challenges. Healthcare delivery in the modern world is becoming increasingly complex and costly. I repeat, it's becoming increasingly complex and costly. In fact, I joke most times that patients who come to you as doctors, they come with their diagnosis, and they also come with their prescription as to what they think, management as to what they think that you should order for them, and also their own prescription. Why are you not giving me this instead of that? So in the technologically advanced world that we're living in, it is becoming more complex. So it means that we have to be more on our P's and Q's. Rising healthcare costs, global supply chain pressures, workforce competition, and increasing demand driven by aging populations and the growing burden of chronic diseases continue to place a strain on health systems, particularly in small island developing states such as Dominica. These realities, however, have sharpened our focus and reinforced our strategic direction. In response, the hospital is placing renewed emphasis on improved staff training in customer service, time-efficient service delivery, and strengthening diagnostic capability. By improving how patients are received and supported, enhancing efficiency across services, and investing in faster, more accurate diagnostics, supported by the systems such as the HMIF which I just mentioned, we are positioning ourselves to meet modern healthcare challenges with resilience, professionalism, and compassion. Our chairman spoke to the financing of the authority, and I too would like to add that we have some exciting proposals that have been formulated towards easing the burden, the financial challenges that we face at the authority. And of course, looking forward to presenting to the Board of Directors and of course, Mr. Chairman, their subsequent approval. And looking forward to this. Yeah. So in closing, you're making my case public. So in closing, would like to extend to the Minister. In closing, would like to extend my sincere appreciation to our doctors, nurses, allied health, and PS. I forgot to. In closing, would like to extend my sincere appreciation to our doctors, our nurses, our allied health professionals, support staff, management team, Board of Directors, all our partners, our central government, Minister, PS, and the people of Dominica. Our achievements thus far, and indeed our ability to continue to provide secondary healthcare service to our population is a direct reflection of your dedication, professionalism, and shared commitment to excellence in public health care. As we look ahead, ladies and gentlemen, my dear friends, I and the Dominica Hospital Authority, management and staff will remain fully committed to this institution and to the people we serve. And we look forward to serving you Look forward to serving with and for you in the months ahead, as challenging as they may appear to be as we speak. Because together we are not just building a hospital or strengthening a hospital, we are strengthening the health of the nation. I really thank you for listening to me.
Thank you, Dr. Darrow. We know this press conference has been a little long, but we open the floor now for questions from the media.
Good morning, members of the head table, and good morning to everyone here this morning. Curtis Matthew of DHS Radio, and my question is about some concerns I heard this morning about patients coming to the hospital when they should be at the health centers. What I would like to find out though is, are these health centers accessible? And do they have the equipment that these patients can access the help that they're looking for, the care they're looking for? So that would be my first question. Are these patients able to access the health centers? And do you have the equipment at the health centers that these patients need to go to? There was a concern in Dominica 3 years ago about the migration of nurses. And so there was a concern 3 years ago about the migration of nurses, that nurses will leave in the system. A number of nurses will leave it. Can you update us about the situation now? Do you still have that problem where nurses are leaving in droves for overseas? And I may just want to ask a final question. It has to do with doctors. I think Dr. Darrow, you mentioned it slightly. The Minister for Health last year announced that there would be a new structure in terms of salaries for doctors. Can you just update us as to what is the position right now? I will ask these 3 questions for now, and I will look for answers and then possibly come back with it.
Look, in the media, they just say, that's all the questions.
We have to look at time and so on. But we'll see what happens. I will just hold the mic and I will
Greetings again, and thank you very much, Curtis, for your questions. So first one I will seek to address is the issue of access to health and wellness centers around the island. But before I delve into that, let me speak a little more about the structure. So we have about 50 health and wellness centers around the island, spread over 7 health regions. In each health region, we have at least one type 3 health center. For various countries who may use different jargon and terminology, it is similar to a polyclinic, where you have services. It's not quite that of a hospital, but we have a lot of services at our type 3 health centers. I wish to say further that what that represents in terms of the number of health and wellness centers we have across our various regions, based on our population, that we have, I would say, an access ratio of 1 health and wellness center to 1,420 people in Dominica. So that definitely shows a good investment in people in access and equity. I wish to state further that this primary healthcare model that we have here in Dominica is something that started off in the late 70s, early 80s, of which people like Dr.
Dr. Etienne of blessed memory would have been a champion, and many more nurses, even some of you who are here and some who have trained you. So that is very important to note, and many countries, even most recently in November of last year, have been studying our model of care. So there is in fact access. What is important to note though, and I am referencing from comments made by Dr. Monroe, which are in fact very important, where many people are coming here to A&E for care. We are noting further that after 4 o'clock, when many people are finished with work, that's when they choose to access care. And that is some of the phenomenon that we are seeing. So while probably right now you will see the A&E area, the waiting area, has somewhat low activity, we'll see that picking up from 4 o'clock when people have left work. So that in itself tells you something, that headache that you may have been able to bear or withstand throughout the day maybe is not so critical. It maybe in fact isn't quite the emergency that we are thinking it to be. And that is a challenge that we're having. But also it's important to be fair, for us in governance and in government, because many of the health centers are closed at 4 o'clock. And with that being the reality, then it is difficult to access care in the primary health setting after 4 o'clock. So we have a model where we have our primary health care givers on call. So it is in fact possible to access care in our 7 health regions after 4 o'clock, but it's based on the on-call model where we have doctors, nurses either living right there in the various facilities or nearby within very close proximity where they would be available. But in these modern times and observing closely people's behavior, especially here, we recognize the need to foster more agility and flexibility within our system. So we're experimenting with a change that is likely to start in March of this year, where we will commence with Mao Health Center, where the hours of operation will likely extend from 4 p.m. to 8 p.m. Then after that, we will do the very same with Newtown from 4 p.m. to 8 p.m. And we expect that to directly impact the type of service that is provided to our people and reduce the number of patients who come to A&E to access services. And to put that into greater perspective, it's important to understand that we are in the Roseau Health District. From a total population in Dominica of about 70,000, we have 7 health districts, and more than half of our population, I'm speaking of 40,000 people living in and accessing our Roseau Health District. So that explains the type of pressure that our A&E department is subjected to on a daily basis. So that is expected in the coming weeks to have direct impact. So I'm really hoping that helps. And as we start here, this being the pilot, then we extend to expand as we go along. In terms of the issue of nurse attrition, this is a global phenomenon that affects every single country. It is very difficult to address this for many countries. What you see in large measure is that many clinicians are attracted by very high wages in a few countries in the Middle East, which I will not name. And then you find that many nurses, doctors, and so on from the United States, even the UK, go to these countries for high salaries. And what you find is a void in these countries, and the very same happens. Our clinicians go to the UK, the US, various countries. And even so, we see that trend for many of the islands in the Caribbean who really, in fact, like when we think of the BVI and so on, their mother country is the UK, and they pay wages, based on the UK remuneration. And it is difficult when we look at the dollar conversion, what really that means 2.7 to 3.2 to $1. That is the harsh reality. So notwithstanding, even though cost of living is difficult for many of us in the OECS, it is even higher in that region. So it is not easy, and it's not an easy decision for even our own nurses to make to migrate. It's not easy, and we are conscious of that as government. So we have noticed a tremendous reduction in nursing attrition over the last 3 years. I think 3 years ago was almost like peak panic from the numbers from 1984, and we have done quite a bit to reverse that to a point where we are pretty stable right now, and we recognize that stability is something that has to be continually addressed. That was as a result of increasing wages from 6 to 12 and 13% in some cases, improving the nursing structure and the opportunity for upward mobility within the structure. Many people who receive salaries at the lower rate within their particular range or scale are now increased, or even at a higher scale. The appointment of over 100 nurses within the last year and a half, which is quite significant to bring that stability. We have had quite a bit of ceremonies for recognition for our staff, some led by the ministry, some by Dominica Nursing Association, some by the hospital, some actually by the Nursing Council most recently. So these things help, and training opportunities for people, and just providing more resources, a better environment and framework for working. These are things that are ongoing, and even right now with our new nursing structure, quite a few new positions will be created for nurses. With the doctors, it's the very same thing, with 26 appointments sanctioned or approved by cabinet. That creates that environment of stability. And with the increasing wages that cabinet would have approved late last year, which is taking effect, we're in the process. And not only that, cabinet actually approved increases. And one of the things that we would have addressed would be in lieu of private practice, and also an inducement, an increase to remain with us. And even upon the first consultation and approval by cabinet, we felt the need to, get a feel from the doctors and so on, if this is something that would have addressed their issues and their concern. And we felt there was a need to review and to improve. And this is the spirit of governance that we like to provide, and we believe is fair and dignified to offer to our people, to ensure that our people remain. There is no better feeling to know that care is administered by one of our own, and I am really grateful for the champions who are here, who have chosen to remain with us. They could have gone anywhere, they've chosen to stay, and I sincerely appreciate that, and I commit to ensuring that we will do even more to retain your services and to value you and give you the dignity that you absolutely deserve. Thank you.
Yes, Curtis, I'd just like to add some, I'm a person with numbers. So in the last 3 years, we've lost 7 nurses. And what the minister pointed out is accurate. What our data shows is that, of course, globally, nursing, if I had to go back to school, I would do nursing. Because then I can work anywhere in the world. WHO and all the international organizations indicate that by the next decade, the world will need over 10 billion nurses. The thing about Dominica, the problem doesn't even affect us. It affects us slightly, but here's what's happening. We have 2 nursing schools. Let's suppose we lost 7 nurses in the last 3 years. The average nursing school graduate, Dominica State College and All Saints, 18 nurses a year. So we can fill the nurses. The minister addresses salary issues. And I want to also send a message to nurses that Dominica, there's a concept that we pay low salaries, we can't get people. We have done research when we realized there's going to be a problem with Cuba. Ghana can give us nurses paying the same salary if we give them housing. Botswana, Uganda, all these Commonwealth countries are available. So, and Dominica is a place anybody would want to work to. There's a lot of CO, life is good in Dominica. So we do not really have a nursing problem with other countries. But we are on top of it. So right now we have nursing vacancies, we can fill it, and we have students waiting to be employed. So we're doing well with the nursing issue.
So my final question is to Dr. Daru, or of course the minister. When I come to the Dominica China Friendship Hospital, I see great facilities. The facilities at the hospital are tremendous. But there remains a concern among many Dominicans I've spoken to. Right, so as I said, my question is for the minister or Mr. Dr. Daru. When I come to the Dominica China Friendship Hospital, I see great facilities. The facilities are tremendous here at the Dominica China Friendship Hospital. But there remains a concern among a number of Dominicans I speak to about coming to this facility. Some people tell me that they fear coming to the hospital. They talk about the level of care for patients in Dominica. I don't know what the problem is over the years, but I continue to hear the concerns, as I said, in spite of the great facilities here. Do you think the hospital authority has been able to deal with that situation effectively in terms of managing that problem that we've heard in Dominica over the years? Thank you very much.
Thank you, Curtis. I think you're going to have a field day, you being the only media person there.
We have to live in one.
Okay, cool. Okay, nice. Well, first and foremost, coming on the heels or in the aftermath of the presentation of Mrs. Shillingford Sorrento, I'm a little surprised, that this was raised because she presented the figures, the actual figures. And also subsequent to a number of our presentations, including mine, where I mentioned that one of the main, and in fact I remember when speaking to you, my very first interview, I did, this came up, where I felt that I was asked by yourself, probably the longest serving media personnel, in Dominica, most experienced, that what would be my vision or my primary goal for the Dominica China Friendship Hospital, and that was to try to reinstate the public's trust and confidence in the hospital. Hence the reason why we mentioned the appointment of a public relations officer, communications officer, to highlight the positive, because unfortunately, as I mentioned in my presentation, it's always the isolated negative incidents that get the most airtime, the most airplay, and of course I'm propagating this even in this forum. It really is not helping, because the figures that Mrs. Shillingford presented spoke, I think, loudly for themselves. I think that we have been doing the inadequate job of blowing our own trumpet in presenting our achievements. I mean, I just mentioned to you the significant success we have had at the neonatal in the neonatal department. These things will be highlighted. I'm sure you probably never heard that anywhere before. Or if it was mentioned, it would have just been maybe just passed over. But here comes this story of somebody who felt that maybe a nurse looked at her too hard, or at least maybe didn't tell her good morning, or maybe didn't speak to her, or maybe a friendly tone, and this will of course get millions of views. So the point I'm making is that I tell people, and of course even myself, when I was Minister of Health, I would highlight to our health service providers that communication is key. Sometimes body language. A lot of these little things sometimes when people come to seek assistance, healthcare, and I think Dr. Monroe alluded to it, that when people come to this facility, any health facility, they're not well or their loved one isn't well, and they're looking for answers. The anxiety levels will be sky high. So the onus is on all the healthcare providers to be conscious of that and treat them accordingly. Understanding that these are people who are seeking answers, they're seeking solutions, as to what is going on with their loved one. I tell people, if you follow these basic steps as healthcare providers, that from the onset, that people feel that you, starting from the very first, the orderlies, the nurses, the doctors, if people feel that you are going to do the best that you can to help their loved one get better, even when the result doesn't go that way, because we are not God. People will die. And I think Dr. Monroe alluded to the fact, especially our male population, usually these are people who seek medical attention when most times they're already beyond they're already at the point or beyond the point of no return. You with me? So people will die. Don't get, we're not God. But we have to make your relatives and loved ones feel that, hey, we tried our best to ensure that their loved one will get better. And when the results go the other way, they will defend you instead of complaining. So I think a lot of this has to do with the customer service, the approach. People, as I said, feel that they come to this institution and that each and every one of us, the nurses, the doctors, the radiology, the lab, that they will do what they have to do in a timely and efficient manner to get their loved one better. And they will understand when the loved one doesn't get better, especially given the condition. What are we going to do? We've instituted, as I said, a public relations officer. We mentioned the patient support unit, which is most likely going to deal with existing quality control. People will have a safe place, to voice their concerns, their observations. And we encourage people to not just lodge their complaints and concerns, to also come to share the positivity. So that being said, we will continue, of course, the training. I met recently with the nursing administration. I see most of the wonderful, I call them the big nurses, the nursing supervisors. I met with them recently to try to encourage them to put more training and ongoing. I think it's called, we call it CMEs in medicine. I think they call it in-service training in nursing, to try to put more of this program in place to encourage. So while people might have knowledge, sometimes the bedside etiquette, the body language, the communication skills, we have to try to continue to enhance these skills. So people will leave the facility knowing, in spite of the outcome, knowing that we did our best to help the loved ones get better. Thank you.
On the issue of confidence in the care, and which is exactly what you're asking, that people, the numbers are getting so bad, especially in morbidity, that people are afraid to come to the hospital. But the staff and the minister and our hospital have indicated that we are, in terms of standards, we meet national standards. There are certain things that we have to understand of socio-dynamics in our country. That we do not have a hospice system in Dominica. So a terminally ill patient who is 89 years old from St. Joseph, Lubia, wherever, they come here. They have very little people to take care of them. They take them here, we take care of them, and they will pass. And then that's counted as a morbidity. Now, we have cases where patients come here, and when we call the family, we stabilize them. There's no family to go, and so they occupy beds for months. And so I think people have to understand Dominica is different. There's a lot of compassion as a hospital administrators and the chairman of the board. The scientific thing to do is bed days supposed to 3 to 5 days. We are 7. People know we're not going to put a patient out just because we need the bed. And so these are some of the values that impact our health delivery. And the answer, Curtis, is to try to bring it somewhere in the middle. Good service, but deal with the issues with families, take patients. We have, sometimes the staff have asked me, we have 2 people living in the ward. They call their staff, they call their family, the address they give us from Granby, they really don't live there. So there are a lot of complications with the system, and it's reflected in the numbers. I'm not happy with the numbers when I hear all the morbidity rates that we see. And certainly we want to address that, but we have to do it collectively, the community, the government, and ourselves. And we will find a solution. But the care at Dominica China Friendship Hospital in Marigot is second to none. We are similar to every other hospitals anywhere in the world. That's it. Thank you.
Thank you, Dr. Dara and our chair. Curtis, that's it for the questions? Okay, because we have gone a long time, so next press conference you'll be there. Okay, so we are taking the necessary steps to improve patient care, which is one of the top priorities for the Dominica Hospitals Authority, and to deliver healthcare, proper healthcare. So that brings us to the end of our press conference, but before I conclude, Dr. Darren made mention of some of our partners. Recently we had the Windward Ultrasound Group complete a training with some of our medical professionals here. We also had the Rotary Club deliver newly rehabilitated project to the acute psychiatric unit. The World Pediatrics is an ongoing therapy session. Today is the final day, I believe, where they are doing some speech therapy. And also the medical professionals on a mission who recently handed over some equipment to the A&E department. So we do have a lot of partners. We thank our partners for their continued support, and we encourage more partners to come on board to help the hospitals. So I want to thank our head table, the Minister for Health, Wellness and Social Services, Dr. Donald Peters, Chairman, CEO Dr. Kenneth Daru, Dr. Carl Monroe, A&E Specialist, Mrs. Sherry Shillingford Sorrendo, Manager of Health Management Information System, and of course Mr. Bernard Barry, who is the Safety and Security Manager for their words today. This press conference was very informative, so I hope the public is listening to all what the hospital has to offer. Thank you for being here, and of course to our friends from the media, we look forward to more collaboration with you as we look to improve our transparency and public appearance. So thank you everyone for coming. We do have some light refreshments because we know it has been a very long session, so you might be hungry. So we have a few light refreshments. Healthy refreshments. Healthy. Thank you. This comes to the end of our press conference.